You might not know this, but doctors in the UK and most other countries have to demonstrate that they're up to date with stuff that's relevant to what we do. Our annual appraisal checks that we've done things like basic life support and safeguarding courses, which are great. We read articles in professional journals that help us to know what's going on in the wider world of our speciality. They can be deadly dull, to be honest. When I was a trainee, we had to convince some of our bosses that we actually understood the statistical methods used and be able to criticise the materials and methods of the studies. Some people seem to revel in this, but me, well, I just wanted to learn surgery and get better at it, to be honest. It's no wonder that I never became an academic. But when I get an hour or two, I do look at the journals, not because I have to, because actually I want to stay up to date. I look at the Journal of Arthroplasty and the Bone and Joint Journal. That one's published in the UK. The editorials and the research papers reassure me that what I do professionally is evidence-based and good practice. So today I thought I'd give you a taste of what sorts of things are in the journals at the moment. Hot off the press is this study looking at how using a surgical robot to do hip replacements affects the outcome. I've done quite a few of the Mako cases, but I stopped doing them last year. The robot was cumbersome, it got in the way, and the surgery took longer. To my mind, it didn't really make any difference to the outcome. This study confirms my experience, which is reassuring. It doesn't really make the surgery any more successful, and there was a higher rate of heart, kidney and wound problems compared to not using a robot. The authors wondered if this was due to the increased surgical time. Patients might have gone home more quickly, but the surgery cost more. It's work in progress. It might be the case that large-scale studies in the future will show a benefit to using a robot, but we're not there yet. Another interesting and relevant paper from the UK this time looked at the effect on quality of life of waiting for more than 6 months for a hip replacement. As many of you know, waiting times are horrendous for elective surgery here in the UK. Patients were asked about their quality of life and their hip function using standard questionnaires that are used in these sorts of studies. The results showed that the quality of life got worse, but not necessarily due to worsening hip function. Living with a painful hip affects every aspect of your life. Even if the hip isn't physically getting worse, your health suffers because you're tired, anxious, frustrated and fed up. It's common sense really, but it is important to know that there is objective evidence to confirm this. Finally, here's a paper about sexual function after hip replacement, looking at which positions are more likely to cause a dislocation. We did a study on this several years ago in Southampton and found that most people had significant improvements after surgery. Many of the patients were worried about the hip dislocating, which is a horrible complication to have, particularly if you're in the throes of passion. Fortunately, it happened very rarely. This study from America used data from preoperative CT scans to develop a geometric model of the hip replacement to see which positions were most hazardous for both men and women. This graphic, look away now, from the study shows the results. It's a small study with only 12 patients, but it will help us to give the best advice to our patients about what is, after all, a very sensitive subject. I hope you've enjoyed this little romp through the current literature and found it interesting. If you'd like to know more about any of these issues, then please get in touch. The details are below in the description. If there's anything you'd like me to look at and do a video on, then please let me know. I'm always on the lookout for new ideas. Thanks for watching. Until next time.